I'm 80 years old. Last month, my doctor looked at my echocardiogram twice. He said my heart looked like it belonged to someone 20 years younger. He asked me what I was doing differently. I told him, 1 bowl every single day. Let me show you exactly what's in it and why it works. First, some numbers. My resting blood pressure is 118/76. My LDL cholesterol dropped from 162 to 94 in 8 months. My triglycerides dropped by nearly 40%. No new medications, just one daily habit added on top of my normal diet. Here's the bowl. Every morning, I eat a mix of 5 ingredients: oats, walnuts, ground flaxseed, blueberries, and extra virgin olive oil. Let's break down exactly why each one matters. Oats contain a fiber called beta-glucan. Beta-glucan binds to cholesterol in the digestive tract. This helps the body remove it before it enters the bloodstream. Clinical studies show 3 grams of beta-glucan daily can lower LDL cholesterol by 5 to 10%. 1 cup of cooked oats provides close to that amount. Walnuts are next. Walnuts are one of the few nuts rich in alpha-linolenic acid, a plant-based omega-3. Omega-3s reduce inflammation in blood vessel walls. A 2018 study in the Journal of the American Heart Association linked daily walnut consumption to improved artery function in older adults. I eat exactly 1 small handful, about 7 walnuts, each morning. Ground flaxseed is next. Flaxseed contains lignans, a plant compound with antioxidant properties. It also contains soluble fiber, similar to oats. Research from Canada found flaxseed intake was linked to measurable blood pressure reduction in adults over 60. I use 2 tablespoons ground fresh, not whole seeds, since ground flaxseed absorbs better. Blueberries are next. Blueberries are rich in anthocyanins, a flavonoid linked to improved blood vessel flexibility. A Harvard-affiliated study found regular berry consumption was associated with a lower risk of heart attack in older women. I use half a cup, fresh or frozen. Last is olive oil. Just 1 tablespoon drizzled on top, not cooked. Extra virgin olive oil contains polyphenols, which help protect the lining of blood vessels. The PREDIMED study, one of the largest nutrition trials ever conducted, found olive oil intake reduced cardiovascular events by roughly 30% in high-risk adults. That's the full bowl: oats, walnuts, flaxseed, blueberries, olive oil. Same 5 ingredients, same time every morning, for the last 2 years. Now, here's what changed in my body and when. At month 3, my triglycerides started dropping. At month 6, my LDL cholesterol dropped noticeably. At month 12, my blood pressure stabilized without needing a dosage increase. At month 18, my doctor ran the echocardiogram that surprised him. He said my heart's pumping efficiency, called ejection fraction, was strong for my age. He said my arteries showed less stiffness than expected for someone 80 years old. I'm not a doctor. I'm not claiming this bowl is magic, but the ingredients in it are backed by real research, not trends. Here's what I tell anyone wanting to try this. 1, consistency matters more than perfection. I eat this bowl nearly every day, not occasionally. 2, portion size matters. More isn't better here. 1 cup of oats, 7 walnuts, 2 tablespoons of flaxseed, half a cup of berries, 1 tablespoon of olive oil. 3, this is one part of my routine, not the whole picture. I also walk daily. I limit added sodium. I get my blood work checked every 6 months. 4, talk to your doctor before changing your diet, especially if you're on blood thinners, since flaxseed and omega-3s can affect clotting, especially if you have kidney issues, since some nuts and seeds are higher in phosphorus. This isn't a replacement for medication. It's not a cure. It's one consistent habit that supported my heart health alongside medical care. If you're managing high cholesterol, high blood pressure, or just want to protect your heart as you age, start small. Try the oats and walnuts first. Add flaxseed and berries once that becomes routine. Add the olive oil last. Small, consistent habits, done for months and years, not days, are what actually move the needle. That's the bowl I eat every single day. That's what surprised my doctor. And that's what I wanted to share with you. Take care of your heart. It's the only one you get.